by far is at the ankle joint. We'll see it again in the next section. Now that we've seen all the muscles that arise or insert at the knee joint, let's see how they all fit together. You can use this overview as a brief review section. Here on the front are quadriceps, sartorius, and gracilis. On the back, here are semitendinosus and semimembranosus. Here's biceps femoris, and here's gastrocnemius. Here's plantaris and popliteus. Now we'll move on to look at the principal veins, arteries and nerves in the region of the knee. We'll begin where we saw them last, just below the hip. We'll follow them to just below the knee. With the main artery and vein, there's a change of name that we need to understand. In the upper and middle thigh, they're known as the femoral vessels, but below the adductor hiatus, they're called the popliteal vessels. The same vessels, just a different name. Here's the thigh with the skin removed and a strip of subcutaneous fat taken out so that we can see the long saphenous vein. Here it's in the middle of its course from the ankle to the top of the thigh. To see the femoral vessels, we'll remove the superficial fat and deep fascia. Here are the femoral artery and vein at the point where we saw them last, disappearing beneath the sartorius muscle. To follow their course, we'll remove sartorius and also gracilis. Here's vastus medialis, here's adductor longus, with adductor magnus behind it. The femoral vessels pass beneath the roof of the adductor canal and through the adductor hiatus. To see where they emerge, we'll remove semimembranosus and semitendinosus and go round to the back. Here are the vessels emerging behind adductor magnus. They're now known as the popliteal artery and vein. A little above the knee, the popliteal vessels are joined by the sciatic nerve. At the back of the knee, the popliteal artery lies deep to the nerve and to the popliteal vein. To see the artery better, we'll go to a different dissection in which the muscles are intact and the nerve and the vein have been removed. Above the knee, which is just here, the popliteal artery gives off these two superior genicular arteries, lateral and medial. At the knee, it gives off these branches to the two heads of gastrocnemius. And below the knee, it gives off these two inferior genicular arteries, medial and lateral. The popliteal artery then disappears deep to the two heads of gastrocnemius. We'll see where the vessels go from there in the next section. Now let's look at the nerves. In the last section, we looked at three major nerves, the obturator, the femoral, and the sciatic. We'll follow the sciatic nerve in a minute. The obturator nerve and the femoral nerve we don't need to follow any further, except to remind ourselves of the muscles that they supply. As we've seen before, the obturator nerve supplies obturator externus, adductor brevis and longus, and the anterior part of adductor magnus. The femoral nerve supplies iliacus, pectineus, all four heads of quadriceps, and sartorius. The obturator and femoral nerves also have sensory branches, some of which go below the knee. We'll leave these out. We'll go on now to look at the sciatic nerve. We saw the sciatic nerve a minute ago with the hamstring muscles absent. To see the whole picture, we'll add the hamstring muscles. Here are semimembranosus and semitendinosus. Here's biceps femoris. Here are the two heads of gastrocnemius. The space that's bounded by these muscles is called the popliteal fossa. As we saw in the previous section, the sciatic nerve passes deep to biceps femoris. Here it is emerging. Here are the popliteal vessels coming in beneath the semi-muscles and passing deep to the nerve. Above the knee, the sciatic nerve divides into two major nerves, the tibial nerve and the common peroneal nerve. The The tibial nerve runs downward in the midline and passes between the two heads of gastrocnemius, along with the popliteal vessels. The common perineal nerve diverges laterally, running just behind the tendon of biceps femoris. It passes around the neck of the fibula, here's the fibula, and passes into this muscle, peroneus longus. We'll follow the further course of both these nerves in the next section. Of the muscles that we've seen in this section, the tibial nerve supplies popliteus, gastrocnemius, and plantaris. We'll conclude this section by briefly reviewing what we've seen of the vessels and nerves of this region. Here's the femoral vein and artery, the superior genicular arteries, lateral and medial, and the inferior genicular arteries, medial and lateral.